Yes, I think it is absolutely insane that you go into your provider, you say, I have excruciating pain, and they look back at you and they say, oh, that's normal. And then they like move on with a checkup. If you were anyone else having excruciating pain and you went into your provider, that would be the thing they would look at. But sometimes in pregnancy, somehow that's not the thing we look at. So today I'm going to tell you, if you're experiencing pain, what you can do with your provider to get some help. Now, when we're talking about pain during pregnancy, it's really important that you learn from an expert. In case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am here to get you prepared, not scared, for your upcoming hospital birth. And if we've met before, welcome back. Now, these aren't the only tips I have. I actually can give you my best labor tips if you just sign up. I'll put the link down below. Now, the honest fact is pain is part of pregnancy. If you like this video, go ahead and subscribe. Nobody wants to hear that, but pain is a part of pregnancy. So you have to realize that your provider is constantly seeing people who are in a lot of pain, but they also need to address all the other complications of pregnancy that are going on. So sometimes when you say I'm in pain, they're like, yeah, everyone is, and then they move on. Is it helpful? No. Is it right? No. So what can you do? Okay, the first thing when you're having pain during pregnancy is to ask yourself if it is safe pain. So that means, are you early in pregnancy and these might be contractions? Is this pain suddenly getting way worse and lasting a really long time? Along with this pain, do you have other symptoms like fever, burning, other things like that? Those things are going to trigger a visit to either your provider or to labor and delivery if you're experiencing other things besides the pain. So make sure that you're safe before you go on for these other questions. Pro tip, most providers has somebody on call for them 24/7 that you can call and ask these questions to if you're concerned. Okay, the second thing you need to know is, do I just wonder if this pain is normal? Because some people have sharp pains that come every once in a while and they're mostly wondering, is it okay? Or is it something that I need to get fixed? Meaning, this pain is affecting my life, I really need some help with it. Because there are a lot of people who just want to know if what they're experiencing is normal and if everything's okay and if baby's okay. And if that's you, then that's what you need to get from your provider. But some people want to fix for their pain, and that's sort of a different question, unfortunately, when you're at your provider's office. Now, a pro tip, your provider is actually not that great at fixing those types of pains or helping you with body mechanics or things like that. They need to pass that on to somebody else. So it's important for you to realize that this often isn't something that they can fix, but hopefully they have resources that they can give you. Now, most often that's going to involve a physical therapist, maybe a chiropractor, although I do see a lot of OBs who have a really difficult relationship with chiropractors, but hopefully there's a great one in your area. Pro tip, if you're looking for a chiropractor, recommend somebody with the Webster method training, because those people are trained especially for pregnancy, which is really important, versus just a regular chiropractor. It may even include something like a massage therapist, which sounds pretty good to me when you're pregnant. And you want to realize that doing this is going to require some effort on your end. So you want to be aware that you want to make some effort to fix this pain. It's going to be calling to get the appointment, maybe waiting for the appointment. Unfortunately, I see a lot of physical therapy offices that can't get people right in, especially the ones that are good with pregnancy. You might need to change some things in your lifestyle, change how you're doing things, not take the stairs, take the elevator, change how you're getting out of your car or even putting your pants on. You're going to have to make changes in your life to maybe decrease this pain. Some of these take multiple visits. And while I'm not here for the chiropractor who says I need to see you every day, it may be that you need to see them throughout the rest of your pregnancy to really make this condition feel better. And then you're also going to need to probably do some work when you're not at the doctor. There's probably stretches you're going to need to try or things like that you're going to need to do in your downtime. So I'm not saying there is a magical fix to this type of pain, but there often are things you can try. Sometimes providers have a few things in your office that they can try, including trying a belly band or stretches you can try, or just some basic lifestyle changes to maybe help with pelvic pain or something like that. These can be great if you just want to try a few things and maybe don't want to go to all the effort of finding a physical therapist or a chiropractor. Now, what should you do if your provider just ignores it? When they say, yeah, it's normal, and you're like, but they just move on. It's really important that you use terms that we recognize in the medical field for this is really a problem and we need it fixed, because sometimes it's just too easy to ignore you on those quick visits, unfortunately. The thing that I recommend that you guys say is that this is really affecting my day-to-day life and I am not able to do the things that I need to do in my life. I think that should really be a trigger for your provider to know that it is something that you need more help with. Now, keep in mind, if you come into your next appointment, you haven't called the physical therapist, you haven't done anything on your end, that gives the provider the feedback that maybe it's not worth it getting people the referral to the chiropractor or whatever. You want to make sure that you're doing your work on your end, as it is really affecting your day-to-day life. And if some of you have an insurance that would just pay for a physical therapist without needing a referral, you can just start to ask around. I think a physical therapy consult is great for pretty much everyone in pregnancy, and it is so great to have a relationship already built so you can visit them postpartum. Finally, it's really important to know that a lot of these pains are not going to be fixed. Sometimes they can be minimized, sometimes they can be reduced, sometimes they can be fixed, and you can start to live a much more pain-free lifestyle. But some of them are just going to be there until you deliver your baby, and then you're probably going to need to do some things after you have your baby to regain that lifestyle that you're hoping for, unfortunately. Pregnancy is hard on our bodies, it's hard on our backs and our pelvises, and this is the unfortunate reality of that. Now, you might be thinking, Hilary, this is so complicated. Why is it so hard to get my provider to do what I want? And I'm here to tell you it's going to be tricky in the hospital as well. You need to have the communication skills to talk with your provider throughout your pregnancy, which is why I recommend a high quality birth class. I recommend the online prenatal class for couples because it is created for couples because you want a teammate, not just a cheerleader. It's affordable and it's taught by an unbiased, evidence-based expert that you can trust. I'll put the link down below. Okay, what types of pain are you experiencing? One of the things we hear most often is about ligament pain. I'm going to put a video all about that right here, but tell us down in the comments, what kind of pain are you experiencing? I think we're going to all find that we are struggling with our pelvises and maybe other places on our body as well. Okay, guys, we'll see you around.